Do you ever feel like your muscles are weakening for no apparent reason? It might be something you never considered. Medications. The truth is, millions of people take common medications every day that could silently be robbing them of their strength. Did you know that certain drugs can directly affect your muscles and cause weakness, making everyday tasks harder than they should be? In this video, we'll uncover the hidden connection between these medications and muscle weakness, and what you can do to protect yourself. Imagine going for a walk and suddenly feeling like your legs aren't supporting you as they used to. It's not just getting older. It could be the side effects of something you're taking. Many of these medications are so widely prescribed, yet we often overlook their long-term impact. So, let's take a closer look at what might be happening and how you can take action today. It's time to stop letting these medications control your strength, because your muscles deserve better. Stick around, because understanding this could change the way you approach your health from here on out. Number 4. Benzodiazepines, like diazepam and lorazepam, are commonly prescribed to manage anxiety and sleep disorders. These medications work by calming the nervous system, but they can have unintended effects on your muscles. When you take them regularly, they can cause muscle weakness and decrease muscle coordination over time. This happens because benzodiazepines slow down the communication between your brain and muscles, making it harder to move or perform simple tasks. Imagine trying to lift a grocery bag, but your arms feel unusually heavy, or even just walking becomes challenging. Over time, this can impact your daily routine, leaving you feeling weaker than before. Ignoring these side effects can lead to falls or injuries, especially as your balance is compromised. It's not just about feeling tired, it's about being physically limited in what you can do without realizing why. You may think this is just a sign of aging, but it could be the medication at play. Have you noticed these changes? Maybe you're already feeling the effects and haven't made the connection. So, before increasing your dose or taking another pill, think about how it might be affecting your body. In fact, some medications are even more likely to affect your muscle strength than benzodiazepines. Relaxants like cyclobenzaprine and carisoprodol are often prescribed for muscle pain or spasms. While they help relax tight muscles, they can also cause weakness in the long term by slowing down your body's muscle recovery process. Picture yourself in a situation where you're trying to get up from a chair, but your legs simply don't respond as they once did. This can be a result of these medications, which may leave you feeling physically drained and unsteady. If you rely on them too often, it could also make future muscle injuries harder to heal, and you could experience more frequent muscle strains or pain. So, before you take that next dose, think about whether it's making you feel weaker than usual, and whether there's a safer alternative. Now that we've covered the muscle weakness with benzodiazepines, let's talk about something that can affect your muscles even more directly. If this content is helping you in any way, show your support, subscribe to the channel, and leave a like. Number 3. Muscle relaxants, like cyclobenzaprine and carisoprodol, are commonly prescribed to treat muscle spasms or pain. These medications work by interrupting nerve signals to the muscles, which helps relieve discomfort. However, overuse of muscle relaxants can lead to muscle weakness, which may affect your ability to perform everyday activities. When these drugs are used regularly, they can slow down your body's natural muscle recovery process, leading to prolonged weakness. Imagine trying to get up from a chair after sitting for a while, only to feel like your legs won't cooperate. This is one of the effects muscle relaxants can have on your body, making simple tasks feel like a struggle. If ignored, this weakness can progress, leading to greater difficulties with mobility and even increasing the risk of falls. The loss of muscle strength can affect your overall quality of life, leaving you feeling more dependent on others. If you've been using muscle relaxants for some time, you may not realize how much they're affecting your muscles. Think about whether you've noticed a decline in strength or balance since starting these medications. You may think it's just the aging process, but it could be the medication contributing to this decline. It's crucial to understand the potential long-term effects of these drugs, especially if you rely on them frequently. If you feel like this might be happening to you, it's worth consulting with a healthcare provider about alternatives or adjustments. Additionally, reducing or eliminating your use of muscle relaxants can help regain some of that lost strength. A balanced approach with physical therapy or other treatments may also be beneficial. In some cases, switching to less muscle-debilitating pain management options could improve your overall mobility. Now that we've discussed the effects of muscle relaxants, let's look at another group of medications that could be impacting your muscles in unexpected ways. While you're listening, go ahead and subscribe. It really helps our content reach more people. Number 2, selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine and sertraline, are commonly used to treat depression and anxiety. These medications work by increasing serotonin levels in the brain, which helps improve mood and reduce anxiety. However, one of the side effects of SSRIs is that they can cause muscle weakness and stiffness. The exact reason behind this is not fully understood, but it's believed that SSRIs can interfere with the balance of neurotransmitters that control muscle function. Imagine trying to walk or climb stairs, but your legs feel stiff and unresponsive, even though you haven't been active. This could be a sign that the SSRI medication is affecting your muscle control and coordination. If left unchecked, muscle stiffness from SSRIs can limit your range of motion and make everyday movements more difficult. Over time, this can lead to discomfort and even pain, especially in the joints or back. The impact on muscle function might not be obvious at first, but it can gradually affect your daily routine. Have you noticed any changes in your ability to move freely or any stiffness in your body? It could be worth discussing your medication with your doctor to explore other options. Sometimes, switching to a different antidepressant or adding muscle-relaxing treatments can help. If you find that this is happening to you, a small adjustment in your treatment plan could make a big difference. Many people experience this side effect without even realizing it, thinking it's just part of aging. It's important to stay proactive about your health and keep track of any new symptoms you experience. In some cases, your doctor might recommend a physical therapy plan to improve mobility and flexibility. Addressing this issue sooner rather than later can help you maintain a better quality of life. Let's now look at another class of medications that can directly affect your muscles, sometimes in unexpected ways. As you follow along, show us you're enjoying it. Hit the like button and subscribe to the channel. Number 1. Corticosteroids, such as prednisone and dexamethasone, are often prescribed to reduce inflammation and treat conditions like arthritis or asthma. While these medications are effective at managing inflammation, they can also weaken muscles over time. Corticosteroids work by suppressing the immune system and reducing inflammation, but this can also lead to muscle loss, particularly with long-term use. This happens because corticosteroids can decrease protein synthesis in muscles, which is essential for maintaining muscle mass and strength. Imagine trying to lift a bag of groceries, but your arms feel weak and fatigued, even though the bag isn't heavy. Over time, this weakness can progress and affect your ability to perform daily tasks like getting out of bed or climbing stairs. The longer you take corticosteroids, the more likely it is that muscle weakness will become a problem, potentially leading to a loss of independence. If ignored, this muscle loss can severely impact your mobility and overall health, increasing your risk of falls and fractures. The gradual decline in muscle strength might not be obvious at first, but it can become more apparent as time goes on. It's easy to dismiss this as just part of the aging process, but it could be a side effect of your medication. If you've been taking corticosteroids for a while, you might find that you tire more easily or struggle with simple movements. As the medication continues to suppress your body's natural healing processes, muscle strength becomes harder to maintain. Have you noticed feeling weaker or more fatigued than usual? If so, it might be time to consider speaking with your doctor about adjusting your treatment. Physical therapy and muscle strengthening exercises can often help counteract some of the muscle loss caused by corticosteroids. By staying proactive and monitoring your symptoms, you can help preserve your strength and independence. Now that we've explored the effects of corticosteroids, let's take a closer look at another group of medications that could also be weakening your muscles. If you're finding these tips useful, don't forget to subscribe and hit the like button. We've discussed some of the most common medications that might be weakening your muscles, such as corticosteroids, SSRIs, muscle relaxants, and benzodiazepines. While these medications are essential for managing various health conditions, they can come with side effects that affect your muscle strength. It's easy to overlook these changes as a normal part of aging, but they can gradually affect your ability to stay active and independent. Have you noticed any signs, like weakness or stiffness, that may be linked to the medications you're taking? It's important to pay attention to these signals and reflect on how your medications are impacting your body. The good news is that it's never too late to make adjustments and take control of your health. Talking to your doctor about alternatives or adding treatments like physical therapy can help restore strength and mobility. You have the power to improve your well-being, so don't wait until these effects become harder to manage. If you found this video helpful, consider sharing it with someone who might need to hear it too. Leave a comment below with something you've learned or a thought you'd like to share. And remember, taking care of your muscles is taking care of your future.